Welcome to today's Odyssey. Many of us have a morning routine that just doesn't feel complete without a hot cup of coffee. In fact, statistics show that over 60% of Americans drink coffee every day. At the same time, a large percentage of the population takes prescription medications for various health conditions. What many people don't realize is that there can be interactions between coffee and certain common medications. The caffeine in coffee can potentially change how these medications are absorbed and metabolized by your body. In today's video, we'll take a look at some of the most common prescription medications that you shouldn't take together with your morning coffee. Understanding these interactions can help you better time your coffee breaks and get the full benefits from your medications. Let's dive in and explore some need-to-know information for coffee lovers who also take prescription meds. This video is for informational purposes only and is not intended to replace professional medical advice. Always consult your doctor before making any changes to your medication or diet. Let's start with medications used to treat hypothyroidism, also known as underactive thyroid. This condition means your thyroid gland is not producing enough thyroid hormone, which can lead to symptoms like weight gain, joint pain, and fatigue. That isn't good news. One of the most common medications prescribed for hypothyroidism is levothyroxine. Unfortunately, studies show that drinking coffee can significantly reduce the absorption of this medication. Coffee has been shown to decrease the body's absorption of levothyroxine by up to 60% when taken close together. Why does this happen? Levothyroxine is best absorbed on an empty stomach. When you drink coffee soon after taking the medication, the caffeine appears to interfere with its absorption in the gut. Not getting the full dosage of your thyroid medication can lead to ongoing symptoms of hypothyroidism. Have you ever felt tired or sluggish even after taking your thyroid medication? Maybe it's because you drank coffee too soon after taking it. Try waiting for at least 30 minutes and see if you notice any difference in how you feel. It's recommended to take levothyroxine first thing in the morning, then wait at least 30 minutes before having your first cup of coffee. Drinking coffee later in the day poses less of an issue. Another group of medications that can be affected by coffee are those used for diabetes management. I see some nods in the audience. Yes, diabetes is super common today. If you take medication for diabetes, listen up. Gulping down coffee with those pills can spell trouble. Here's why. Caffeine can cause spikes in blood sugar, which works against what your diabetes medication is trying to do. Keeping blood sugar stable is key for managing this condition. Research also shows the caffeine in coffee may increase insulin levels. For people with diabetes, elevated insulin can worsen symptoms and lead to risky complications down the road. Not where we want to be. So what should we do? It's simple. Just allow some time between taking your oral diabetes medication and having that first cup. 30 to 60 minutes is ideal if your schedule allows. This gives the medication time to be fully absorbed without caffeine disrupting things. It's extremely important that you control your blood sugar levels for diabetes management. Did you know that over 34 million Americans have diabetes? That's more than 10% of the population. If you're one of them, you know how challenging it can be to keep your blood sugar in check. Don't let coffee make it harder for you. Wait a bit before enjoying your brew and let your medication do its job. Moving on to our next category of medications, let's talk about how coffee interacts with common antidepressants. Many people take selective serotonin reuptake inhibitors, or SSRIs for short, to help manage depression. Unfortunately, some SSRIs like fluoxetine, also known as Prozac, don't mix well with coffee. Studies show that drinking coffee while on fluoxetine can increase side effects like insomnia, headaches, and jitteriness. Not the intended outcome. Caffeine also seems to change how several antidepressants, including fluoxetine, are broken down in the body. This can result in lower absorption of the medication when paired with coffee. The takeaway: it's best to avoid drinking coffee within an hour or two of taking certain antidepressant medications. Give the medication time to be fully absorbed first. With some minor timing adjustments, you can avoid interfering with your antidepressant treatment. Your mental health deserves that consideration. Now let's explore how coffee interacts with Alzheimer's medications. Many Alzheimer's medications work by protecting neurotransmitters in the brain that affect memory. However, studies show that caffeine can minimize the effectiveness of these drugs. Here's how. Caffeine causes the blood-brain barrier to tighten, restricting the medication's access to the brain. Less medicine reaching the brain means impaired results. Coffee also seems to counteract the protective neurotransmitter effects of Alzheimer's drugs like donepezil and galantamine, not ideal when Alzheimer's already progressively damages memory function. Did you know that Alzheimer's affects more than 6 million Americans? That's a lot of people who need their memory and cognitive function protected. If you or someone you love is taking medication for Alzheimer's, don't let coffee get in the way of its effectiveness. Drink it sparingly and at least an hour after taking your pill. Your brain will thank you for it. In summary, be mindful of timing when drinking coffee with thyroid medications, diabetes medications, antidepressants, and other common prescription pills. Give your medication adequate time to absorb before enjoying your coffee. With some minor adjustments, you can make your morning medication and coffee work together safely and effectively. Thanks for watching today. If you found this video helpful, please like and subscribe. It's the best way to bookmark us and get notified when we post new content. Do you have any questions or comments about this topic? Have you ever experienced any interactions between coffee and medications? What other topics would you like to see in the future? Let me know in the comments below. I'd love to hear from you.